Do you frequently struggle with persistent headaches that feel completely different, intensifying when you wake up in the morning, or suddenly throbbing when you cough, sneeze, or bend forward? Or perhaps you or a family member just received an MRI scan showing an unexpected lesion or a mass. Let's pause, breathe, and stop the panic spiral right now. Today we break down the definitive medical facts regarding brain tumors. If you're looking for a complete guide on brain tumors, this video is exactly your roadmap. Hello everyone, I'm Dr. Ravish, a board-certified neurosurgeon. In my practice, the word tumor instantly strikes absolute terror into hearts of families. However, a significant portion of that paralyzing fear stems from a widespread medical misinformation. In this complete guide, we will look directly past the myths and address 5 key components around brain tumors. First, what are the types of brain tumors? Second, red flag symptoms you should never ignore. Third, demystifying your diagnostic MRI scans. Fourth, answering the ultimate question: do all tumors truly need a scalpel? Fifth, how cutting-edge advanced engineering makes modern brain tumor surgery remarkably safe. Although a long video, make sure you watch this video till the very end to understand complete information about brain tumors. Let us begin with the absolute basics. What exactly is a brain tumor? A brain tumor occurs when a specific cells inside your skull experience a genetic or a replication error, ignoring your body's natural commands to stop growing and resulting in abnormal cluster of a tissue. To understand why this causes symptoms, you must realize that your skull is a completely fixed and a closed structure. It's like a hard container made of solid bone. Because the skull cannot expand, a newly growing mass inside naturally compromises, compresses, or displaces your healthy brain tissue. To understand your diagnosis, we must first look at where the tumor originated. We categorize brain tumors into mainly 2 distinct types. One is primary brain tumors. Primary brain tumors are basically masses that are actively developing within the brain tissue itself, or the blood vessels inside the brain or surrounding the brain, or its protective membranes. Second is secondary or metastatic brain tumors. These are always malignant masses where the cancer began somewhere else in the body, such as lungs or breast, and traveled through bloodstream directly into the brain. In adult neurosurgery, secondary tumors are highly common and require a completely coordinated approach with an oncologist. When talking about brain tumors, you must understand the single biggest misconception. A brain tumor does not automatically equal to aggressive cancer. Benign brain tumors, grade 1 or grade 2. They are commonly seen non-cancerous, slow-growing masses with highly distinctive boundaries. The most common primary brain tumor we see is a meningioma, which grows slowly from the protective layers around the brain. Yes, there is malignant brain tumors or grade 3 or grade 4 tumors. They are rapid, aggressive, and highly infiltrative cancers, such as glioblastoma, which rapidly invade the neighboring tissue, that is healthy white matter. So you might think that benign brain tumors are completely safe. But here's the catch. Even a benign brain tumor can become clinically dangerous if its physical size creates pressure on vital brain areas like brainstem. The next question is, what are the tumor warning signs? Most commonly, we see something called as early morning surge of a headache. A tumor headache is typically more intense during early hours of 4 a.m. or 5 a.m. When you lie flat for hours, your intracranial fluid pressure naturally raises, worsening the throbbing sensations. First-time seizures. Experiencing a sudden, unprovoked seizure or a fit in adulthood without any prior history of epilepsy is a critical indicator of a cortical irritation. A focal weakness, a progressive loss of motor control on exactly one side of your body, such as drop attacks, dragging your leg, or unexplained facial numbness. Some brain tumors present with no headache at all. They might present with some other signs like loss of peripheral vision. This isn't a simple vision blur. Sometimes patient often unexpectedly starts bumping into doors or objects located specifically to their sides, either to their right side or their left side. Unprovoked projectile vomitings, sudden forceful vomitings that occur instantly without any prior feelings of stomach nausea or acidity, frequently accompanied by a central vertigo. If you're holding an imaging scan right now, let's understand how, as a neurosurgeon, I would diagnose or what kind of tests would I do in a brain tumor. A standard X-ray cannot penetrate the skull's bone density to view a soft tissue. So basic CT is required to understand if there is a brain tumor or not. But the gold standard is always contrast-enhanced brain MRI when it comes to a brain tumor. By injecting a specialized gadolinium dye, an MRI scan acts as a sub-millimeter camera, highlighting the precise coordinates, structural boundaries, vascular blood supply, and the fluid swelling surrounding the brain tumor. Next, let us answer the burning question. Do every single brain tumors require immediate surgery? The short answer is no. As a specialist, I evaluate every case based on the tumor's grade, location, and its stability. For a tiny, completely asymptomatic, slow-growing benign tumors like an incidental meningioma, our primary goal would be simple active surveillance, monitoring the mass with serial MRIs every 6 to 12 months. If the brain tumor is actually causing a neurological problem, or the neurosurgeon feels that it can cause a problem in the future, we usually prescribe a treatment plan. Most commonly, a treatment plan includes a surgery. Let us directly address the cultural myth that a brain surgery is inherently high-risk gamble, inevitably causes permanent paralysis, memory loss, or vegetative states. This outdated fear stems from decades ago when visualization tools were limited. If you enter a neurosurgical operation suite in 2026, you would be amazed with the technology we use. We no longer operate blindly or make massive dangerous disruptions. The mathematical precision of modern engineering has fundamentally transformed our safety profiles. During a brain tumor surgery, the first tool that I use is something called an intraoperative neuronavigation. This lets me exactly plan where the brain tumor is there inside the skull, thus making me plan the incision to the precision, making the incision smaller, the skull opening smaller. Sometimes, when the tumors are located close to the vital structures, we are using something called an IONM or intraoperative nerve monitoring. This helps us precisely avoid any micro damage to the vital structures like the cranial nerves. Even for the tumors located in eloquent areas or critical areas such as your speech center or the motor center, sometimes we are doing awake craniotomies, meaning the patient is actually awake during the surgery, thus allowing us to do precise surgery, not damaging or disturbing any normal functions of the body. Finally, what I mean to say is that today our clinical goal has completely shifted. We do not just preserve survival, we aggressively protect your quality of life. To conclude this video, we understand that a brain tumor diagnosis is undeniably challenging. But with modern neurosurgical technology, minimal invasive options, and excellent recovery is entirely possible. Do share this video with someone who's been recently diagnosed with a brain tumor and is completely anxious. Let them go to a proper care and get the right treatment done. Stay informed, protect your health with clarity, and I'll see you in the next video.